Hello everybody, this is my Psychopathology discussion 1. First, our question is to define psychopathology versus what normal mental functioning is. Psychopathology is basically the definition of any in-depth study of problems related to mental health. And these could include the elements of the behaviors, the causes, like in your genetics or biology, any social development, and the treatments and strategies in order to fix it. I like to think of this as core disturbances that have developed in a person, regardless of their culture or their inheritance. And so the opposite, normal mental functioning, it's obviously difficult to define because, what is normal? But we can think of it as the general human conditions of thinking, emotions, and behaviors throughout everyday living. The next question is, what is the first step in helping someone who comes to you with any mental health concerns? So the first step is basically determining whether the person's actions are normal and if they require any help being seen by a psychologist, psychiatrist, and you want to inform those people if you determine it not to be normal, or just even inform a nurse or somebody, any type of professional that you can find. And they're going to want to listen to the patient, explain the full range of the symptoms, and this is important because it can, help establish how severe the current problems are. Next is, what are the key criteria in determining the presence of a mental disorder? And what I found interesting is that most psychologists, they actually determine whether there is a disorder by focusing on the results of the behaviors, not the behaviors themselves. And the behaviors that are considered maladaptive and cause significant personal distress and interrupt daily functioning are more likely to be the ones that are labeled the disorder. Also, most psychologists do diagnose through using the DSM-5, which is the Diagnostic and Statistic Manual, 5th edition. The next question is, what purpose does making a diagnosis serve? There's actually 3 components to the question. The first purpose is to help both the patient and the clinician guide an appropriate treatment plan. Next is actually establishes a prognosis for the patient and their family. And third, it helps to enable communication among different professionals, such as the insurers involved in any of the patient's care. And next is, what are the disadvantages of giving a diagnosis? The certain disadvantages are that labels can be placed on the person. And this could be, stigmatizing in society if, they need to get a certain job or anything like that. There's also a risk that you can misdiagnose patients or possibly overdiagnose them. And this does happen more often than you think. It's a pretty common occurrence. And last, there is some critics of the DSM that believe it oversimplifies our human behavior and that you can't just put us all into categories. Next is to explain how you as a social worker diagnosing can become aware of the culture in the diagnostic process so that you can overcome any biases that you find. I feel like the main way to help out with any of the biases is by fighting excuses that you often hear in the profession, such as people saying they're too busy to figure it out, But what you have to do as a social worker is to constantly question your own actions and like what diagnoses that you're putting on your patients, and listen to your inner self and figure out why you're making the certain diagnoses that you are. And that's it.